So if you recently had knee replacement and you're trying to do everything you possibly can to recover from the surgery, you're going to want to pay attention to this video. In this video, I'm going to go over the 6 mistakes you don't want to make after knee replacement to help you recover faster and get back on your feet again. So if you're new to the channel, my name is Dr. Mike. I am a physical therapist and I commonly treat patients that have just had knee replacement and literally see them less than 24 hours after their surgery. Now, I've seen patients who have done really well with their outcomes and have recovered from surgery fast, and I've seen the opposite of patients not doing so well. So today's video is going to talk about maybe some of the things that you can prevent from happening to help your recovery go smooth. So let's start off with the first mistake people make, is either walking or standing on their surgery leg for too long. Now, I'm not saying that it is bad to be walking and you're not supposed to be walking. Obviously, we want you up on your feet. However, we should not be walking for exercise and surely should not be going outside trying to build a bunch of miles on our feet. Not only is this going to increase your pain, it's also going to increase your swelling. And let's be honest, you cannot speed up the recovery process 2 to 3 weeks after surgery. So yes, you should be walking, but you should not be walking too much on your feet, because you can make your surgery worse. The second mistake I see people make is not having a support system set up at home. Now, this can be a friend, a family member, a spouse. Either way, you're gonna need some help managing your medications, knowing what to take at specific times of the days so that you don't get behind on your pain medication regimen. Your surgeon has recommended specific parameters of how and when to take the medications for a reason. And as soon as you get behind and you can't keep track of when you took your last medication, the pain can get unbearable. And this is why having an accountability partner, having someone that can basically log and track all of your medications and timing of when you're supposed to take them can really be helpful and can allow you to focus on getting adequate rest and sleep during this recovery process. The third mistake people make after knee surgery is simply underestimating how they're positioning their leg. So if you take a look at my finger here, and this is my knee capsule, this is my foot. I know it looks a little bit funny here, but a lot of the times patients will place pillows solely underneath their knee because it feels comfortable for them. And what happens is it puts those hamstrings and those calves on a shortened position, which then makes it more difficult to straighten your knee out. And this is something that's not really talked about a lot after surgery. So when you're positioning your leg, make sure you either keep it fully straight or extended if you can tolerate it, or even positioning it up on a wedge can be really good. But just do not place pillows behind the knee because your knee will get very tight, and soon enough, you may develop a knee contracture. That does happen. So remove those pillows underneath. The fourth mistake, which I believe is the most obvious for people, but surprisingly people are still not doing this, is working on your range of motion exercises consistently. Now, it's going to be very critical after surgery that you work on your range of motion exercises 2 to 3 times per day, and you're going to be working on them for quite some time now, anywhere between 4 to 6 weeks. Now, there will be some progression on those exercises, but range of motion is key after surgery. So you want to make sure that you're getting in all those exercises consistently, frequently taking your knee through end range, extension, and flexion. The fifth mistake I see people make after knee surgery is walking without a walker too soon. Now, you may feel confident and you may have the ability to take a few steps or walk 10 to 15 feet without the walker, or may even say, hey, I can actually walk with the cane. And that's terrific. Maybe it's not a balance component that's restricting you from using another device. However, when that knee gets tired and when that knee gets fatigued, you are going to develop a limp. And what happens if you continue to walk with a limp, you are developing a poor pattern movement as you're walking. And so what I typically recommend for my patients is I want them to continue to use the walker far out from 3 or 4 weeks. Some of them may feel like it's not needed. However, I am more concerned about the quality of their walking, the quality of their gait pattern, and I want to make sure that when it is time to transition to a cane, that they are not limited by pain, They are not limited by their range of motion, and they are surely not limited by their muscular endurance. And they're able to take nice, full, big steps without worrying about their knee collapsing or being unstable. So focusing on good walking with the walker and building up more time on your feet, walking 300, 400 feet, and seeing how your knee is tolerating that is going to be key before you transition off to the cane. So the last mistake that I see people make after knee replacement is they are constantly comparing their progress with somebody else's. So they may have a family member or they may have a friend that may have recovered faster or at a quicker rate or maybe doing different exercises, but you need to focus on your own journey. You have to understand that you don't know what everyone's situation looks like. You don't know what medical history or diagnosis they have. You don't know what their support system looked like. You don't know how active they were. So the only thing you can focus on is focusing on your recovery and focusing on what you can do now. So not only does comparing your results in your surgery with somebody else make you discouraged or feeling down, but it also makes you feel like you're behind and that you need to keep working harder. And sometimes patients will try to overdo the exercises or overdo the walking just so they can feel like they're making some progress. Rest assured, you're going to be fine if you're working on managing your pain, if you're working on these exercises consistently. Your recovery is going to look different than somebody else's, okay? Now, these are the top mistakes that I see patients make after knee replacement, and if you can focus on eliminating these from your recovery process, you're going to realize and see that you are recovering faster and better than ever. So I hope this video was informative for you, and at the end of the day, I just want you to recover faster and to get back on your feet as fast as you can. Please make a comment below if you are doing any of these mistakes now and what you're going to do to make those changes. Thanks for joining me today. Please like and subscribe this channel so I can continue to make videos like this to help you guys out. Have a great day, and I'll see you in the next one.